Okay, great. So we're going to move on to our third speaker. Some of you guys may remember Dr. Natasha from the last IMG conference. Again, fantastic feedback from that particular talk. I think she answered lots of questions that you guys have about internal medical training or IMT or core medical training or CMT, and there's lots of terms that people ask us about. She's MBBS in Karachi in Pakistan, started her UK career in Poole Hospital fairly recently, but is a current core medical trainee year 2, and her aim, it was at least her aim last year, to be a respiratory consultant. She can tell us if that has changed this year. But thank you so much, Dr. Natasha, for joining us, and we look forward to your talk again.
Hi, Natasha. We're just doing a quick poll.
That's fine.
Yep. So something should have come up in front of you guys. Have you considered a career in medical training, core medical training, internal medicine? So as predicted, really, 7 out of 10 of you have thought about a career in internal medical training, and you may well be thinking about a particular specialty at this point, or you may just be thinking about internal medical training in general. I'll let Natasha go through the differences, and 30% of you have not thought about this as a potential career, and maybe this talk might change your mind a little bit. So I'm going to hide that poll.
Yeah, so thank you so much, Dr. Aman Arora and Dr. Pooja, for having me here. So my name is Dr. Natasha Javed, and I'm currently working as an internal medicine trainee, still in year 1, but nearly there to complete and start the 2nd year in August. So I'm working in East Midlands, and before I talk about internal medicine training, I would like to talk a little bit about myself and my, sorry, just want to get rid of this. Yeah, so how can I? Yeah, so talk about my background. So I graduated, so I'm from Pakistan. I graduated from Sindh Medical College, Karachi in 2016. And after that, I did my house job from Jinnah Hospital, Karachi, which is equivalent to foundation year 1 training. And then I worked in a cardiology hospital after that for a year. It was a private hospital. And while I was working there, I was able to take all the exams, including IELTS, FLAT Part 1 and 2, which is the best thing, like I said last year as well, that the best thing about PLAB pathway is that you can really do this exam and it's doable while you're working. In this way, you can at least finance a bit of your exams, and it's doable because everyone is doing that. And then after that, sorry, I got my GMC registration on 15th of June. And then I applied for literally all the jobs which were available on the NHS website, but mainly I was interested in medicine and also the CV I was having by that time was also really reflecting how important medicine was for me. So I got 3 interviews in a week time after applying for all the jobs available at that time, and I was shortlisted for all of them, but then I chose Poole Hospital because the curriculum of that job and the job specification was really in line with what the foundation year doctors are doing if they're graduated from the UK. So a little bit about like I've talked about myself, I'm going to talk about steps to internal medicine training and how I have done it and how you can do it, because that's the whole talk is about. That's what the whole talk is about. Most of you know what internal medicine training is, and like Dr. Aman has just said, that if you want to be a gastroenterologist, or you want to be, if you have any specific specialty in your mind, you need to do this 3 years of training program, in which 2 years would be the ones in which you would be rotating for 4 months. You will be having 6 rotations. Each rotation would be of 4 months, with ITU and elderly care would be the mandatory ones, like I have discussed in my previous talk as well. And there is another addition for the which is the 3rd year, which will be you working for 6 months in acute medicine, whereas the other 6 months would be basically focusing on the specialty you are interested in. And during that time, you would be assessed whether you are competent enough to start working in the UK as a registrar, which is a huge responsibility in itself. So the main idea why we are having this 3 years of internal medicine training is because they want you to be really ready to work as a registrar, because you should be really competent and really confident in making those decisions, because you'll be the one leading the on calls during the night time, and lots of things would be relying on the decisions that you are going to make. And during these 3 years, you get enough time for yourself to get your MRCP exams done, including part 1, part 2, and PACES. But also during these 3 years, you would be expected to maintain a portfolio which is different than the ones which we use normally during the non-training or the foundation year. It's the JRCP-TB portfolio, and it involves you lots of competencies, and there's a whole curriculum, and there's a whole ARCP decision aid, which involves many competencies, and they're all explained very well. So you need to maintain that portfolio while you're working as a trainee, and it's always it's quite challenging anyway. So before you come into internal medicine training, you should really know that you should be really good, and you should be really enthusiastic first of all, and dedicated to the specialty. And I think it's not only about IMT, it's about every specialty you want to do, because this is something you'll be doing every day, so you should be really interested in doing that. So talking about the pathway to UK is, I think everyone is familiar with, you need to take an English language exam, then you take PLAB 1, PLAB 2, and then you get GMC registration. So PLAB 1, the dates they were opened in June for the next year, for 2023 year, they were open in June. And now GMC is going to open the dates for 2023 in November 2022, like this year, November. So make sure that you get your IELTS or OET not only done, but you also make sure that you make an account on the GMC website and you put in your score, so that the day they open the dates for you, you are ready to book it. Because you can't put in your scores, your English language scores, the day you want, because this has happened with people last month. This is why I just want to emphasize that just make sure that you put in your dates, your scores the sooner rather than later, because when the day they will open the dates for you, you won't be able to put your scores. And even if you want to take your PLAB 1 exam in August 2023, you need to book your exam in November 2022, because it's very organized now, and GMC has done everything to make things easier for the candidates. And then you, after getting your GMC registration, you get job, NHS job, which is the non-training job, like I did in Pool Hospital. And this time you get your competency signed off, including CREST form, ALS, and lots of experience to talk about during interview. You get that while you're working in NHS. So it's a bit of a map, which is like a curriculum towards your attainment of post-CCT degree, like you become a consultant. So right now I'm in internal medicine stage 1. So it's the training, IMT training, and you get your MRCP exam during those, and then you apply for specialty training. So how to apply? So it's the round 1, which is advertised in November, and the application window, it's going to be advertised in November 2022 this year, and application window will be in between November and December. There was no round 2 in 2021, and I don't think there was any round 2 last year. However, few of my colleagues, they told me that they were even invited, they were offered a post till August, which is actually the time when IMT starts. So they were in the waiting list, and then they actually got the offer. So instead of doing round 2, they're basically now giving the chance to the candidates in the waiting list. So just make sure that you are extremely ready and prepared for round 1, and emphasize everything you have got to be competent to get into the training before November. And you apply through the oral 2 system. I'll talk about it later. So group 1, group 2 specialties, the main idea is to let you know that there are ways where you can get a shorter period of IMT training. For example, if you want to apply for any of the specialty in group 2, so IMT can be shorter for you for 2 years. However, if you want to be a cardiologist or something from group 1 specialties, then it's going to be definitely 3 years for you. So before you apply for any training, you need to be eligible, and you should be working your way towards that. So CREST form is the main thing. I'll talk about it. in a few minutes. Then you need to get your 2 years, obviously your experience after 2 years of MBBS, which would be cumulative experience from your home country as well as your experience in the UK, and your degree, obviously English language exam, GMC registration, and ALS. So ALS is very, very important, and it should be done from the Resuscitation Council UK rather than anywhere else. And you should do it as soon as possible, because you won't be able to show them that, okay, I have got a date and I will do it. Can you please offer me the post, or can you please deal with me the way you are dealing, or you're put me into the group with others who have done ALS. They want you to have ALS done for IMT before you apply. So CREST form, obviously it's a big form, it's a huge form. You can download it from the website. It has got many things, and like Dr. Anup was mentioning in his talk earlier this morning, that you basically can, there are many, most of the form you can get yourself signed off in day-to-day practice. Like you decide a day, you go to the hospital, you try getting that signed off. But few things are like, you need to be like you need to have a plan, and you need to know how you're going to achieve it. And you should basically be discussing with your CREST form. I'm telling this because I didn't do it. It was like a mistake, because I don't know why I was reluctant in discussing about the CREST form with my supervisor. But you should just do it straight away. In your first or second meeting, just show them the form and just tell them that this is what I want, and can you please tell me what you expect from me in order for you to sign this form for me. So these are the four few aspects in the form which you need to be really proactive about, and you need to have a plan in place about how you're going to achieve it. So there are some procedures which are mentioned on the F1 curriculum and their foundation year 1 doctors usually attains these competencies by performing them in front of nurses and nurse practitioners. So what you can do for yourself, like what I did, as I mentioned in my previous talk as well, that I used to go to A&E after 5 o'clock, perform these procedures in front of the nurses, and just get them send them a ticket on from my portfolio. And they used to sign it out because they're always very happy to help. And then what you can do is once you get them signed off, you can even teach to the medical students these procedures and get a feedback from them. Because in the UK, really it goes this way, that you see it, you then do it, then you teach it. And it's really interesting in the way that everything works. So the 1 week I was doing these procedures, next week I was teaching these procedures. So you just have to be very active and show your interest in everything that you really want. The second bit of this form, as I mentioned in my previous talk as well, it's really tricky. So you have to have a conversation with your supervisor that how they want you. It's all about how they want you to be assessed with this particular competency about because getting an ALS, like it says, is not sufficient enough. You need to prove that you have got provided effective CPR, and you have done effective resuscitation. Maybe you have led an arrest cycle. So what I would suggest is that you can even get a brief for yourself. You can speak to your simulation fellow in the hospital. Mostly there is a simulation fellow. Speak to them. First, speak to your supervisor how they want you to get this signed off, but just have a plan in place, because it's very, very important, and you cannot get this easily. So just talk about it. Tell this to everyone that you want this. Do you have any ideas? Have you seen anyone else in this hospital getting this competency signed off? Things like that, So if you will not talk about it, if you don't tell them what you want, it's very hard for anyone to see things from your end rather than you talking about for yourself. So QIP, I think people have discussed about how what QIP is mainly about improving something. So everything in every hospital in NHS, things go through the guideline. So there's a guideline for everything. So if you see that people are not following this guideline. For instance, antibiotics, they're not being reviewed the way the guidelines suggest them to be reviewed. So what you do is that, okay, so it's not being done the way it should be. So I'm going to assess this in this 1 week, that how it should be, how much we are lacking. And then you discover that, okay, so only 40% of the people are following the guideline, 60% are not. And then you decide how you're going to bring the change, like talking to people, giving them some information leaflets, putting a screensaver on the intranet, or what, like there are billions of ideas, but then you do another cycle. So make sure you do 3 PDSA cycles, because if you have a good QIP to talk about, especially in your interview, and you have got 3 PDSA cycles done, you can score a lot, and that would give you a very good chance to get into IMT. So like I said earlier about oral too, so this is the portfolio that you're going to fill in. So you have to talk about yourself here, like literally talk everything about yourself. Don't be, I always say, don't be modest. Just talk every tiny thing that you think you have done. And it's really about selling yourself and telling them that how much interested you are in internal medicine, and how much you enjoy working in a hospital setting. And because that's what I did. But there were a few things I didn't do very well while filling this application form. Like I didn't mention about my multi-source feedback and the feedbacks I've achieved from my colleagues. And then when I received the outcome, or how should I say, when I received the feedback from the consultants who assessed my application, they said that Natasha could have discussed a little bit more about how her colleagues have found her while she was working. Although I could have done that, and I was having evidence in the form of multi-source feedback and the consultant reviews, but I didn't do it. So just make sure that you write every tiny thing to every major thing that you have done and things you're proud of. And like your presentations, if you have done an QIP and you have completed the whole QIP and have presented it, you can talk about it. If you have been involved in a leadership program, like I was organizing a simulation training program for international medical graduates in my hospital. And the main idea was to sort of get them to know each other and get them familiar with how simulation training works and all. And I just talked about it, wrote about it, and I got a good feedback because there were no interviews and there was only written feedback which was provided to us by the consultants. So they were happy about it. So pre-interview scores is something which is the main idea, the only, the main, not the only, but it's so important that you make sure that you score yourself now, where you stand now, and then how would you like to proceed ahead in order to score good, or in order to score on the enough to get an interview for yourself. So last year I have described all the domains, but this time I've just mentioned these particularly and have written the minimum to maximum score. But this this is something which used to be earlier. So you need to score yourself from undergraduate degrees and qualifications to postgraduate degrees presentations. If you have got any teaching experience, if you have got any training in teaching, like Teach the Teacher's course, I know is a very good course offered by Oxford University. So you can get that. If you have done any QIP and you have completed all cycles or 3 cycles, you get 8 scores. If you have been a leader somewhere, you have been leading an organization or something, you can score yourself for that. And if you have got any publications or research work or QIP published, so you can get good scores from there. Why I said that the previous scores, they used to be the previous, because this morning I just picked up from the IMT recruitment website that things have changed a little bit. So now they have removed this is the PDF file which was published on IMT recruitment website in June 2022, like just a few weeks ago, 2 weeks ago. So undergraduate degrees, there are no more scoring us for that. And they have, if you can see that they have changed the maximum scoring criteria. for all domains, and now it's going to be 48, although it was 56 earlier, and 40 for IMTs. I don't know why it's 40 for IMTs, but what I would suggest to you is that because it's a lot of information and half an hour is not enough, but I would highly suggest you to go through the IMT recruitment website and have a good read, because if once you read it, you'll know everything, and then you know where you stand if you want to, and you can just plan your things accordingly. So because I didn't have any interview, but now interviews are like the last year there were interviews. So this year hopefully there will be interviews, but everything is anyway unpredictable. But for the interviews you will have I'll just briefly talk about interview. So for the interviews you'll have 4 stations. One of them will be clinical, in which you'll be given a case scenario, and they will be asking your next best management and what would be your differential diagnosis, and how would you be communicating this with the family, and how would you be handing over the information in the case to your colleagues. So you'll be assessed in that way, and then ethical would be basically based on your response towards an ethical situation, like Dr. Abrar was also telling about an ethical station. So it's just going to be like that. Sustainability and commitment and application and training is really about talking about yourself in till date, about your skills, about your achievements, your experience, good experience, bad experience, things that you have learned from your not bad experience. Well, I don't think any experience is bad, you just learn from it. So you just talk about, so they always like about you reflecting on your things that you have learned, and that's it. So this is sort of you can say that it's from like 2013 to 21, so it's sort of a summary, but it's definitely going to change because the maximum scoring has now changed. That's what I've gathered from the website only. So if you are scoring somewhere in between 13 to 30, and that is usually majority of the people candidates they're scoring, and you do good in interview, there are very much chances for you getting into IMT. So this is contingency plan, but this was something which we did because you're not having interviews. So we uploaded the evidence electronically, and like I said, that everything I did, I uploaded electronically, and then I received the feedback. But for you guys, I think it's mainly going to be interview, but who knows. So the process in a nutshell is going to be you submit your application by the end of November, then you're longlisted and in 2 weeks, and then you get an interview. So you get a call for the interview if you're shortlisted by the end of December, and then you go for the interview. I went for the contingency plan. I uploaded for my evidences electronically. So once you're shortlisted, you'll definitely be getting a chance to put your preferences. So you put your preferences, you rank your preferences, and just make sure that you are really careful while doing that, because I was not, and anyway, it was a mistake. So just make sure that you really know what you're doing, and then once you get this email about being selected, that you're selected, then you can accept the offer with you can either accept it with upgrade, or you can decline it, obviously. So if you accept it with upgrade if you have not got the hospital or the program you want for yourself, because it's always good to accept with upgrade rather than accepting it straight away, because in my case I didn't know whether this option means what it means. So I ended up just accepting, but I could have accepted with upgrade, and I could have got even a more better placement anyway. So that's it from my end. A little bit about what I have learned. Thank you so much, first of all, for listening to my talk. But the main thing I have gathered from this whole 1 year of training is, like I said, that you need to be really interested in working in the hospital, and you need to be really on it, because once you start working, you will be having, like in my case last year, I started with on calls on nights. So they want you to be really good, and that is the reason why. So you would, like I said, for the crest home, you can even get your crest home signed off from your home country, because you need someone under whom you have worked for 3.5 in last 3.5 years for more than 3 months, and they can sign you off. But it's always good to do things in the UK and get yourself assessed by someone who is doing it for foundation year doctors who are graduating from UK, and then apply for training and be really ready to work in a hospital, because you can straight away start from on calls, and right there you will see yourself ending with seeing someone who is coming in with exacerbation of asthma or exacerbation of COPD or STEMI or stuff like that. So you should be really ready for that, and just it might, like you have seen, I took 1.5 years as an on training, and I don't regret really, because I learned from it. And I would advise you to be really ready before you enter. That's it from my end. Thank you so much, Dr. Aman, Dr. Pooja, for having me and giving me the opportunity to talk again about internal medicine training.
Thank you, Natasha. So clear again, so focused, so to the point. IMT is a huge topic, and to cram it down into 30 minutes is not easy. So you did a great job. And again, there's a couple of questions, but we have a few minutes with this one because you're so well with the timings, which is great. So we can go through a couple before we jump into the next section. There's a couple of really easy ones early on. Does dermatology require IMT? Yes. What if we don't clear MRCP during IMT 1, 2, and 3?
If you don't, so first of all, I'll tell you, if you don't clear MRCP during your training, you're not going to be the only one. There are people who couldn't. So it's different. I would say that, I'll just say on the basis of my observation, I have seen people working as a registrar at few places without having the exams, but I'm not really sure whether this is something which is acceptable. Maybe like a non-training registrar, stuff like that, like a locum registrar, but not, you won't be able to get, I think you won't be able to get into specialty training with a training number without having MRCP. Yeah.
And is it the case that most people, by the nature of the training they get in the first 3 years, along with the work that they do, are going to pass those exams anyway? I mean, do you see many personally that don't get to that stage and haven't passed?
So mostly people do, but if you don't, it's not end of the world. It's all right. It's usually you get your own chances. You can take an year out from the training and get your exams done, and then you can apply for the specialty training anyway. Yeah, so it's all right. It's all right. You just have to have those competencies in which are mentioned on the JRCPTB and the IRCP decision aid to prove yourself that you're competent in terms of procedures and so many things.
Yeah, and that's an important point to make. And the training is designed to help you not get through these exams, but it builds you up with the level of knowledge and experience that helps you get through these exams.
Exactly.
I want to do a quick question, then Pooja, you might have a couple as well. The name of the Oxford University course that you took, Natasha, I think someone missed it.
Yeah, so it's a teach the teacher's course. It's very good because I took it during my training. I took it last year I think in December. It's very good. It's a 2-day course, highly recommended.
Yeah, Teach the Teacher's course is a very popular course, and lots of doctors do it in the UK, don't they? So yeah, that's an excellent one. Pooja, anything on your side quickly, because there are still quite a few. So Natasha, we will probably hand over a few after, if that's okay, on the chat. But Pooja, any others that you've got that are generic ones that are worth doing now?
Sure.
Yeah, someone's asked, and I think you covered this really, Natasha, is there no exam like MSRA before getting into IMT training?
No, I don't know. There's no exam. It's mainly about the interview itself and the pre-interview scores.
Okay.
Yeah. And just to clarify, sorry, Pooja, just to clarify MSRA, for those of you a little bit confused, MSRA is an assessment that is used for many different specialties or part of application for many specialties, I think 9 or 10. things like general practice and psychiatry and radiology and ophthalmology, but not for internal medical training and not for core surgical training and not for a few others as well. They have their specific entry form. So just to clarify that, I'll be covering MSRA more in more detail in the next talk.
Someone's also asked, is it possible to go directly into core medical training after passing PLAB? Once again, I think you covered that in your talk, but
I think I have seen some, like a few people I've heard, not have seen, I've heard people have done that. It's not recommended anyway, because it's if I'm like a junior doctor, if you like speak to people like people who have been in the UK for a longer period of time, they always suggest that you basically have to, the purpose of being into non-training is to understand how NHS works, because it's so different. I remember the first day I was in the MDT meeting, morning meeting, I was just trying to figure out what they're talking about. What is this discharge planning thing? What is this care home thing? What is this? Because we don't have these things in place. So when you are in IMT, they want you to be very good. And it also with the GP training. So I would not suggest anyone to enter directly into training without having any non-training experience in the UK.
Yeah, and a lot of people, that's why they do attachments, that's why they do standalone jobs, that's why they do things for 6 months, for example, to get used to the system, isn't it, before application.
Yes.
But, you know, we've seen people do the opposite as well and sometimes struggle, but sometimes say it was the best decision they ever made. But you need to think about it carefully, you need to discuss with lots of people before you make that kind of call, I think. And one last final question before maybe we hand over. Before I ask the final question, Natasha, just going through, it's not just all the questions that are coming here. There's lots and lots of comments that are thanking you in great detail. Thank you so much for the talk. Very useful, enlightening talk. So there's a lot of positive feedback from the talk, and thank you guys for doing that. But also, please make sure you fill out the survey and you put that feedback next to Dr. Natasha's name, because we can forward that on to her, and that will be of much higher value as well. So please do that if you can. Maybe one more final question. What if we don't do any research during MBBS? Is that an issue?
While doing MBBS?
What if we didn't do any research during MBBS? Will that be an issue later in IMT training? Yeah, if they haven't, they're a bit worried that if they haven't done it, it was a problem.
I don't think so. So it's just that you won't be getting any scores for that. And that's the reason why we all recommend getting into non-training is you can get so many options. You see, everyone here would be doing something or the other. You can just attach and get along with them and get something for yourself, and then you learn. So that's why we recommend getting into non-training rather than relying on the things you have achieved from your home country, because you always haven't got any evidences for that.
Yeah, agreed. Perfect. And Natasha, are you happy for people to get in touch with you in any particular way?
Yeah, so they can email me on my email address. Can I type it over here? Can I?
Yeah, that'd be great. Just make sure you click entire audience on the drop down. But yeah, thank you once again. Real pleasure to have you on board.
Thank you so much for having me. It's always a good experience. Thank you.
And I think you're the only one that can simplify IMT in the space of 30 minutes. So we're really happy that you came on and did it twice in a row.
I've got a timer. Anyway.
Thanks. Have a great day, Natasha. We'll see you soon.
Thank you.
Bye. Bye.